I'm Dr. Scott Spear, and you're watching the Plastic Surgery Channel.
Hi, I'm Dr. Bill Adams, Chief Medical Officer for the Plastic Surgery Channel, and we're here at our newest show, PSC Hot Bites. And today we're going to be talking about something a little different from the standard plastic surgery topic. We're going to talk about snoring. Snoring is a global problem for everyone. Whether it's your husband, wife, boyfriend, girlfriend, or roommate, someone isn't getting any sleep and they aren't happy. But there's a new novel outpatient treatment for snoring called the pillar procedure. With us now via webcam is Dr. Jennifer Jordan, an ear, nose, and throat surgeon from Dallas, Texas, and snoring specialist. Jennifer, thank you for visiting with us.
Thanks for having me.
Who is a candidate for this procedure and who's not?
Well, the best candidates are people of ideal body weight who do not have associated sleep apnea. Those individuals overall do very, very well. However, people who are overweight and or have significant sleep apnea do not do nearly as well with the pillar procedure as primary treatment.
Well, those are some great insights, and we really appreciate you spending time with us today and taking time out of your busy day. And I think probably we're all relieved to know that there is some hope for those of us who snore.
Thanks again for having me.
We hope you enjoyed this segment of PSC Hot Bites, and be sure to get your next bite on our website, www.theplasticsurgerychannel.com. And until then, we'll see you soon.
I'm Dr. Scott Spear, and you're watching the Plastic Surgery Channel.